This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. Today's episode is titled Super GP versus Staying in Your Lane. Now, let me explain the motivation for this podcast episode. I was actually asked that question by a young dentist client of mine, where she said, Gary, I'm starting to think about the trajectory of my career. And I'm curious about your thoughts relative to the idea of developing my career along the lines of becoming a super GP. Or would I be better to be a little bit more narrow and focused and stay in my lane? So I thought that question was so provocative that it would make a great podcast episode. So this one is just that, super GP or staying in your lane. Hey, before I get to that podcast episode, a couple of announcements to make. The first one is that coming up a couple weeks after this podcast is published, we have our third annual RIDA, R-I-D-A, Virtual Summit. Now, RIDA, RIDA, is both a play on words. We want to help you get RIDA insurance. Now, I know that's not grammatically correct, and my grandmother would have a fit if she heard me using the grammar. But I do like the way it sounds. Help you get rid of insurance. But it's also an acronym. It stands for Reducing Insurance Dependence Academy. This is the third annual. We do this every fall. It's 5 hours. It's happening on Friday, October 27th. It's from noon to 5:30. We give you a little bit of break time in there. So it's 5 hours of CE from noon to 5:30 Eastern time. Go ahead and do the time translation wherever you are. And during that day, we have over 20 guest speakers. We have panels, we have guest speakers, we have Q&A panels, and over 20. And it'll grow before we get there, even more. Experts in their field that have something to do with helping you successfully resign from PPO plans. We're very excited about this year's summit. We anticipate, so far we've done 2 of them, and the first one was a huge success. The second year was even bigger. We expect this year to be even bigger. Now, here's the great news. There is no tuition. We are waiving your tuition as a courtesy for your loyalty and listening to this podcast. So there's no tuition. So to register for that, go to rid.academy, rid.academy, and you'll see registration for the virtual summit coming up on Friday, October 27th. Hope to see you there. Now, the next announcement I have is we have a returning guest speaker, our good friend, Dr. Sunny Spera. And Sunny is going to talk to you about customer service tips. Sunny has some great experience with this and some great tips that you can apply in your practice. With no further ado, here's Dr. Sunny Spera on customer service tips.
Okay, hi, Dr. Sunny Spera. I've been asked to give a few general practice tips, and I'll just go over some things that I think are just important. We'll just call them customer service points that I think, if they're part of your DNA, that's great. If they're not, I think you can learn it. It's really about making the experience for the patient memorable, pleasant, and hopefully painless, okay? But I'm going to focus on just the initial. When a patient comes in, how are they greeted? I think always use a patient's first name or last name, whatever your practice vibe is. Some practices, the doctor goes by his first name, patients are on a first name basis. Hey, Joanne, how's everything? And that goes right down to your team. So if, in our case, our office, our dental assistants typically will bring the patient back. I like them to, open the door, step to the patient, greet them. Hi, Mrs. Jones, welcome. Good to see you. How are you doing? And it immediately takes them down if they're a little bit anxious. And you get a feel. And then as they're walking, there's just casual conversation. How are you doing today? Nice weather. Just, not going to ask them who you're going to vote for in the election. That's not something you want to have a conversation about. It's more lighthearted, and the patient directs it. So then the patient is seated. We'll go over, what they're here for, and I think that's so important, that using the patient's name, and at times I'll forget. I might have to go over and look up, oh, Mrs. Jones, to remember to jog it. But once the patient knows that you're referring to them, it's one of the sweetest sounds in the world to every person who's being called by their own name. So I don't want to discount that. I think that's really important. I think the second thing is, a patient comes back, is creating a low fear, high trust environment. So for us, it's a matter of not talking from behind them, although you have a tendency with computers and all the stuff you have behind the patient to kind of hide. I think you have to come around to the front. If you have your face mask on, what I do is I typically take it down, and then I start the conversation. Mrs. Jones, how have you been? Good to see you. And did you have any questions or concerns about today? Tell me a little bit about it. Or if you sense a person's, feeling anxious, you bring it up. But bring the elephant in the room out, and now you can discuss it. So if you say you seem a little anxious, you okay? Is there anything I can do to help you with that? Most times, patients will take advantage of that chance to talk about it. Okay, so I think just that position. Second thing is, believe it or not, the height of the chair. I don't want to tower above the patient. Well, I'm 6'5", I tower above most people, so I want to be at or below eye level, right? And I know that there's science and there's psychology behind who's in the higher position, and that's why pharmacists are 3 feet higher than everybody else, I think, but there's a difference in that position, so the person doesn't feel intimidated, not throwing something down their throat either. So I think that's really an important dynamic. And listen and rephrase. Oh, Mrs. Jones, can you tell me what's happening? Well, I came down, I bit on this and this side, and it really hurt. I think you listen and then rephrase it. So you were having trouble with the biting? No. I bit on something, and so now the understanding is you're trying to understand them, and nobody cares how much you know till they know how much you care. So I think you have to express that right off the bat and establish that. So I think that open-ended questions, but the rephrasing is so important, and it shows that you are listening and you're trying to listen. Or if a person goes through their history, then I did this and I did that. Okay, let me make sure I understand the sequence. This happened and then it got worse. No, it started to calm. Oh, okay, all right. And you're having a dialogue, and nothing better than dialogue. And then always, to me, permission statements. Do I have your permission to show you what I'm seeing myself? Do I have permission? Would you like to see some photos of this? Not, I'm just going to put these pictures up. The person's like scared to death. Don't do that. Get permission. Involve them. The co-diagnosis, like Omar Reed used to talk about, but get that together. Permission statement, then just explain in the old tell, show, do, like you would do with a 4-year-old, right? What we're going to do today, Johnny, is we're going to do this. There's going to be a little pinch, or there's going to be a little pressure. You're going to feel me push here. The tooth's going to wiggle a little bit. I think we got to do that more with adults than we do with kids. So I don't think you want to miss that. So tell them, you can be nice to show them this water's going to be spitting out. You're going to be wearing these glasses or whatever it is. Show them. And then you can perform it. And at all times you can raise your hand at any point. And a lot of people, they're just going to test that. Oh, okay, stop. And please, if a patient starts to feel something, and you've told them, if you ever feel something, tell me. And then they tell you, don't just say suck it up or sit still, we're almost done. Say, okay, let me make that more comfortable for you. Give them a little more Novocaine. It might take a couple more minutes, but that patient will remember it. And they damn sure will remember if you didn't listen and it hurt them. Because now that's lip service versus honest, sincere compassion and empathy. So that's it. Hope that helps.
Welcome back to the Thriving Dentist Coaching and Action segment. This is Naren, your co-host. I want to take a minute to thank Sunny, a friend of both Gary and I, a great guy, awesome practice owner. he doesn't have to practice, but he does because he enjoys dentistry and he enjoys, improving what he does on a daily basis. So a lot of what he shared in those tips, the customer service tips, as Sunny calls them, are practical, simple tips he had used in his own practice. Go to the show notes. We'll put a link, watch those videos. You will enjoy him literally sharing those tips as well. So thank you, Sunny. Gary, I'm really excited about our topic today, the super GP versus staying in your lane. The super GP versus staying in your lane. Many of you know that I've been co-hosting this podcast with Gary for several years now, and I own and run a business called Equa Marketing, and our focus is helping practices dominate SEO, dominate digital marketing, and grow the new patient base. And the funny thing is, of the few hundred clients we work with, we have different types of clients. There are those niche practices, biomimetic, that's all they do. Just do implants. Some practices only do holistic. So there are those niche practices. And then there are those broad practices, perhaps with multiple associates, large number of people, or even a single doctor practice, but it's, a one-stop shop, what Gary's calling a super GP practice, right? So the question I guess many of you are probably struggling with is, what is right for me? What are the pros and cons? Where should I go? In my experience over the last 17 years, working with these doctors, becoming friends with these doctors, I really don't think there's one right answer. What I have learned over those 17 years is every one of these answers is correct. You just have to follow your heart, know who you are, what you want, and then of course, pick a lane that meets your needs. So Gary, really looking forward to learning from you about this, along with the listeners, the super GP versus staying in your lane.
Yeah, Naren, and as I mentioned in the opening, the topic of this podcast was kind of stimulated by a client, a young female dentist who said, Gary, I'm now starting to think about the trajectory of my career, and I'm really kind of thinking about whether I should be a super GP in my career or maybe stay in my lane. And you're right, Naren, the dentistry comes in a lot of different flavors. And I'll answer that question. As if it was, Gary, what should I do? Super GP or staying in your lane? It depends. Like so many questions, the appropriate answer is it depends. And I think, just like you mentioned, Aaron, the decision should be guided by, where is your passion? Where is your passion? Are you the kind of dentist that enjoys the diversity of lots of different services in your practice? You enjoy taking lots of CE from different areas and then coming back and applying it to your practice. That might steer you more towards the super GP format. Another reason that you might steer towards a super GP format may be a much more practical concept, Naren. You may be in a small town or a remote area where you don't have ready access to specialists to refer to. And as a result, you want to serve your community, you want to serve your patients, and you want to serve your community. And it may not be reasonable to send a patient to an orthodontist that, say, is 2.5 or 3 hours away. So maybe you're guided to offer orthodontic services for your patients to better serve your community. Does that make sense, Darren?
Absolutely. Even like competition, like for example, in some areas, people don't refer to other doctors. So in those areas, doctors tend to do everything in one shop. So I mean, lots of factors, Gary. I totally get it.
Yeah, lots of factors here. There's not one right answer, but I would still use as the primary criterion. I would evaluate, what is your temperament? What is your personality? Do you like doing a lot of different things? Does the diversity of seeing a really wide cross section of patients every day in your practice, does that excite you, or do you look at it more like it's a distraction? When that happens. But it's really kind of truly knowing yourself.
The other dimension I see is also this definition of who you are and how you want to spend your time in dentistry continues to evolve and change. Like even Gary, the clients you have served, like when they were young, they were working, 4 or 5 days and they're gung-ho, and then later on, they want to work less and they want to do certain types of things only, as opposed to, everything they used to do 10 years ago or 20 years ago. So this is not, I don't know, correct me if I'm wrong, like like what I do as a dentist, as a practice owner, tends to evolve.
Oh, it can absolutely evolve. Let me give a good example. I have a client in my client base whose wife was diagnosed with obstructive sleep apnea, and it was through his wife's diagnosis that caused him to take a journey down diagnosing and treating OSA, obstructive sleep apnea, using appliance therapy because of his own familiar experience with his wife. And that was a very motivating factor, for him. So you're right, this can change over time. I'd also like to introduce another concept here. The idea of being a super GP and staying in your lane is not mutually exclusive. You could actually have both of those.
Great point.
Now, you might be scratching your head right now. Let me explain. You can absolutely be a super GP in your practice and make the decision to stay in your lane. Like for example, I have a client that clearly I would describe as a very strong super GP. He has both a fellowship and a mastership in the AGD. And, just having achieved that mastership in the AGD puts him in a very elite company in terms of his clinical training. He's very, very well trained in a wide cross section of services. However, within those services, he stays in his own lane. For example, he's kind of neutral about endo. Let's take a very specific clinical area. He's neutral about endo. He doesn't love it. He doesn't hate it. What I find with most dentists, they tend to polarize when it comes to endodontic therapy, one way or the other. I'll have dentists that say, I love endo, and I like to do as much as possible. And then other dentists will say, oh my gosh, I'd rather slam my head in the car door than do endo. David Hornbrook, who some of you know through this podcast, we've had him many times as a guest and many times as a guest contributor. David is a general dentist in San Diego that has a cosmetic-oriented practice. He does a heck of a lot of cosmetic dentistry. David is extremely accomplished as a cosmetic dentist. He not only is accredited by the AACD, there's only about 400 dentists in the US that are accredited by the American Academy of Cosmetic Dentistry, but furthermore, he's a fellow of the AACD. I believe there's only about 80 fellows altogether. Very, very elite certification. And I asked David one time, I said, David, do you do any endo in your practice? He said, Gary, let me tell you how I feel about endo. Because I'm an artist. And when I do my cosmetic dentistry, I think of what I'm doing as artistic. And here's how I feel like about doing endo. I feel like I am picking locks in the dark. Now, I love that definition. I don't believe that's the correct actual clinical definition of endo, but it does describe it. And it describes someone that's visual and loves to see the result. Do you think he's going to enjoy, cleaning and shaping canals? Probably not. Now, maybe someone would enjoy it because they could look at a 3D image and see the results of their cleaning and shaping, but that isn't really David's thing. But this client of mine is very much a super GP, but he also chooses to stay in his lane. For example, this is also a client who does adult orthodontics in the form of both Invisalign and 6-month smiles, and yet doesn't treat children or teens with traditional brackets and braces. He has a great orthodontic referral source that he can refer to for traditional braces. This is also a doctor that does place and restore implants, but even within placing and restore implants, he absolutely stays in his lane. And I asked him one time, he's a early, late career dentist. Naren, early late sounds like I'm contradicting myself, but he's in his 50s, early 50s. So I think of that as early, late, getting towards late career. And I said, tell me a little bit about, since you place and restore implants, tell me a little bit about your failure rate with implants. And he said, you know what, Gary, the most important criteria for me to use is case selection when I do implants. And I'm very proud to say that we have a very high success rate. And he said, I would love to say that it's due to my clinical skills, but he said, I actually think it's much more due to my case selection. I only pick those cases that I know we're going to be able to treat very, very successfully. And I have a great surgeon that I can refer to on those cases that are more marginal, maybe more compromised, and maybe needs another level of expertise. And he has no problem referring those to a surgeon. So it is not mutually exclusive to be a super GP, but also stay in your own lane. In fact, I think that might be a bit of a recipe for success for anyone. Expand your services to serve your patient base. One of the reasons why I think it's useful to expand your services. First of all, I want to recognize that if you're in a larger area, larger city, or larger town, it's likely that you have some terrific specialists in your community. I think of where we are in Phoenix. We have some really brilliant specialists in every degree of specialty. Now, that may not be true if you're in a small town or if you're remote. And Specialists are such a wonderful component of our profession. So I don't want to take anything away from our specialists at all. They're a very welcome component. And what I teach my clients to do is be very selective about their specialists. And in some cases, it might mean picking one from each specialty that you work with. You have one oral surgeon that you work with, one periodontist that you work with, you have one endodontist that you work with, you have one pediatric practice you work with, and so on. As opposed to what I sometimes see, which I think is a wrong minded approach, and that's that you pull out 5 business cards for oral surgeon in your area and say, here, pick one. No, I think you should do the screening for your patients. Pick the oral surgeon that you believe in. That you believe in not only the quality of the clinical care, but the way they treat your patients. Because when you send a patient there, they in essence become an extension of you. That referral can be either a fabulous experience where the patient is very grateful for the referral, or Aaron, it could be egg on your face. Absolutely.
Great, Gary. I think this is a very personal decision, but I do think that passion, at the end of the day, what do you enjoy? How do you want to spend your time should be the driving factor. And as your perspective on, that those questions change, like I know of a situation where this particular doctor had some challenges with his son and in his breathing, and he went into that direction and he became an expert and he started teaching and he became like a world authority in that whole space. So it can lead you anywhere. I think there's no right or wrong answer. You have to just let your passion lead you, so to speak. And I guess
one of the dynamics that
Yeah.
I've noticed when you refer, if you are going to refer, let's say you make a decision that is something I'd really like a specialist to do. You have to recognize the reality of some patients won't go. They won't go to the referral source.
Right.
And I think one of the reasons is they have come to know, like, and trust you and your team. And now they don't want to roll the dice, even though you're recommending it. They don't want to roll the dice and take the risk that it might not be the same kind of experience they have in your practice. Every client I know has patients that we've referred and they don't go. And when we press them on that, when we ask them about it, they will typically say, well, if you can't do it, doc, I'm just not going to have it done. And that's something else that's very pragmatic and very practical. And now there may be cases where you're not going to do that service, then you have to, then that patient really, we need to guide them into a specialist, and that all the more reason to have a tight relationship with the specialist, so you can assure them that they'll be well taken care of over there, not just a random specialist, for sure. But back to the general question, super GP or staying in your lane. They're not mutually exclusive. I actually think you can do both very well. And if you're the kind of person that likes the diversity of services, that's great. When obviously we call this podcast The Thriving Dentist Show, and I'm asked, what does it mean to have a thriving practice? And I'm going to give you that definition right now. It's a practice that provides personal, professional, and financial satisfaction. Personal satisfaction means you're taking care of patients you enjoy, surrounded by a team you love. Professional satisfaction means you're doing more of the kind of dentistry that you really enjoy doing. Whatever it is that, whatever flavor that is, you're doing more of that. And number 3, financial satisfaction, a little more self-explanatory. You're being rewarded handsomely for your care, skill, and judgment, which kind of leads me to the wrap up to this coaching and action segment. I personally think a great model is to have an expanded function, expanded services, general practice where you do most services in your practice, but you also add selected high-value services. Selected high-value services. High-value services are those things like, say, placing restoring implants, adult orthodontics, cosmetic dentistry, maybe OSA, diagnosing and treating obstructive sleep apnea with appliance therapy, maybe complex restorative dentistry. Again, assuming those are things you're interested in. Maybe it's doing something that's more on the super GP side, which would be using oral conscious sedation for certain patients. But I think that's a great model that kind of falls in line with both of those definitions of super GP and staying in your lane. Stay in your lane on those high value services that are either complicated clinically and perhaps even medically, clinically. You think of the implant cases. You want to be very selective about your implant cases so you're not dealing with the medical complications that might really affect an outcome that is somewhat outside of your control. As we finish up this coaching and action segment, I hope we've given you some things to think about. And I actually think, the idea of exploring an expanded services practice that offers the kind of high value services that just get you excited. One of the litmus tests you can use is if you're thinking about adding a clinical service and you're a conscientious provider, you're going to want to take hundreds of hours of CE to master that service. If the idea of taking those CE courses gets you excited, it's like, yes, I can't wait to do this. Maybe you take a year-long continuum on placing implants, like done with our friend Justin Moody, Implant Pathway. Maybe the idea of doing that, you think, oh my gosh, this sounds great. I can't wait to do that. If you look at it and think, oh, I got to go off to another course, then it probably doesn't meet that definition of something you're passionate about. Naren, let's hit pause here on the coaching action segment. We've got some great questions coming up that allow us to take a deeper dive on this question of super GP or staying in your own lane.
Welcome back to the Thriving Dentist Q&A segment. This is Naren again. Gary, we have 4 questions for you. Let me start with the very first question. Just to remind those who just started listening, the topic today is the super GP versus staying in your lane. My very first question to you, Gary, is, as of right now, I would consider myself a bread and butter general dentist. As I consider clinical areas to add to my practice, is there any particular clinical treatment you would encourage that I add?
What a great question. Well, yes. So again, but the assumption is what I'm going to suggest is something you're interested in. And I'm going to suggest 2 areas that are based on the incident of need, in your community. In other words, there's lots of people that could benefit from this anywhere, whether you're in a small town, a remote area. Obviously, if you're in a big city, lots of people need these. I'm going to suggest 2 very specific things. So these are 2 services that are highly marketable. But again, I would use the initial criteria of only add these if it's something you're interested in. Don't add it if it's like, okay, lots of people need that, but I don't really want to do it. Then the answer would be find something else. But 2 that I would pick in no particular order would be dental implants. And if you're in your own decision-making, if you choose not to place implants, that doesn't mean that implants are not going to be part of your practice. You could choose to work with a specialist, likely an oral surgeon or a periodontist, to place the implants, and then you could do the restoration. So, it doesn't necessarily have to be placing implants, but offering implants in your practice. And then the second area would be adult orthodontics. I know those are very different clinical areas, but let's talk about the demand for both of those. Naren, I'm going to give you some data. Do you know that 76% of Americans aged 35 and older are missing at least 1 tooth, not including wisdom teeth, excluding wisdom teeth? 76%. So more than 3 out of 4 people are missing at least 1 tooth. And fully edentulous people, the number of patients that are older that are fully edentulous, that number is going down every year, but it's still a pretty significant number. The number is 24% of Americans 62 and older are fully edentulous. So what a demand, a tremendous demand, whether it be a single tooth, whether it be replacing a lower denture, floppy lower denture with locators. Maybe you're using a removable lower denture that is secured by a bar and clasp. Maybe you're doing an all-on X case with 4 or 6 implants in the lower arch that you're securing the overdenture by screws. Lots of different ways that you can fit implant practice in your practice. And Naren, you probably know from your experience with Google, in dentistry, that's one of the most searched terms is dental implants.
Absolutely. We have some experience working with clients, and it can be really, really lucrative. I know some clients who make $200,000, $300,000 just from implants every single month.
Yeah, and I'll tell you, on implants, when you look at production per unit of time, there are very few services that will compare to what you can be productive. We just put our business cap on for a minute, than placing and restoring implants. So I would steer you that way, if you had an interest in that. The second area is adult orthodontics. The universe of people that had braces as a teen or young adult, and they were given on their last appointment, they were given a retainer and they were given guidance on wearing the retainer. And guess what they did? They stopped wearing the retainer. They eventually lost it, or the dog ate it. And then they just went about life, and now they're an adult. And guess what's happening to those teeth? Those teeth are shifting around. The universe of people that have crowding or spaces that had ortho as a teen or adult is huge. So I would encourage you to look at an aligner type product like Invisalign. I happen to really like Invisalign, but to be fair, there's other aligner options that you may choose. And also consider a short-term bracket option. For example, like 6 Month Smiles, also very, very much like 6 Month Smiles. There's other versions of the short-term bracket option. 6 Month Smiles are ceramic brackets. They're bonded to the teeth. The orthodontic assistant will replace the wire on the appointment. So each wire has a different diameter that provides the torque on the teeth to move the teeth. And a huge opportunity for adult ortho in your practice, whether it be through aligners, Invisalign, or a bracket therapy. And one of the cool things about adult ortho is it can be largely auxiliary driven after the initial appointment. Of course, the initial appointment's all done by the dentist. In the case of Invisalign, you're doing the ClinCheck appointment. In the case of, say, 6 Month Smiles, you're bonding the brackets on the teeth. But subsequently, much of the appointments are done by an assistant of yours that's trained as an orthodontic assistant. That person is trained in working with the patient with their new aligners, and they're also trained in how to remove the wire and replace it with a new wire to provide the torsion and to provide the torque. So that might be of interest to you in that those are services that are largely auxiliary driven. There's others that I could point to, but those two really jump to mind. Naren, what's your experience with adults looking for adult ortho? Is that something that is once in a blue moon, or there's a lot of it?
There's a lot of it. I would say, in our client base, at least 40 to 50% of them, do adult orthodontics. I think it's because it's something that a lot of people are looking for, and especially those, braces. Even my wife currently is wearing braces, but of course she's using Invisalign. Those braces that are not like the metal braces that are kind of intrusive.
She's using aligners.
Yeah, exactly.
Yeah. Well, and I'll tell you, it's very profitable. Here's another reason to offer high value services. People will pay for what they want before they'll pay for what they need. And those are two services people want. They don't want a missing tooth, or they don't want a floppy lower denture. They want solutions to that. They don't want crowded or teeth with spaces in them. They want adult ortho. So people pay for what they want before they'll pay for what they need. They're less price sensitive around those services because it's something they want.
Thank you, Gary.
Great question.
Thank you. Let me ask you question number 2. I currently provide Invisalign in my practice, but I'm not getting much traction. I have been offering Invisalign now for more than 3 years, and we do approximately 4 starts a year. How can I grow the Invisalign component of my practice?
Man, that's a great question, and I feel your pain, doctor. If you're only doing 4 starts a year, it's almost to the point where it's more of a nuisance than a solid part of your practice. I don't mean to be critical about that, but that's what it is. So a couple things come to mind. Number one, internally. Let's talk about internal marketing. There are tons of patients in your practice, doctor. I can assure you, tons of patients in your practice, because I've found that in every one of my clients that is offering, say, Invisalign or 6-month smiles. You highlighted Invisalign, so I'm going to talk about Invisalign. So here's a quick thing you could do, and you could start this tomorrow in your practice. Talk to your hygienist about identifying patients in the hygiene chair that have either crowding or spaces. Crowding or spaces. That's it. They're looking in the mouth to see if the patient has crowding or spaces. And then your hygienist is going to say to the patient, I'll role play as if you were the patient, Naren. Kelly, the hygienist, might say, Naren, if there was a way to correct the spaces in your teeth without brackets or braces, would you have any interest? And they stop. Now, what our experience has been, most people say something like, yeah, I had braces as a teen. I was supposed to wear my retainer. I lost it. And now my teeth are shifting around. I don't want to look like I'm in middle school again. That was not good. But if it could be done without brackets and braces, yeah, I'd love to hear about it. And then the hygienist, well, we offer state-of-the-art adult orthodontics. It's called Invisalign. You may have heard about it. And as the title would imply, the name would imply, it's invisible because they're done with aligners instead of brackets. If it's okay with you, Naren, I'm going to ask doctor to take a look when she comes in to do the exam. I'm going to ask doctor to take a look and see if you're a candidate. Would that be okay? And what is the patient going to say almost every time?
Absolutely. I would love to.
Absolutely. I'd like to learn more. And then the hygienist does a pass off verbally so the patient can hear it again. So when doctor comes into the exam, Dr. Naren's interested in learning if he could correct the spaces in his teeth with Invisalign. Could you do me a favor and take a look and see if he's a candidate? Now, the beauty of this is how simple it is. Notice what the hygienist is looking for. Crowding or spaces. Notice what she's not looking for. She's not looking for posterior occlusion. She's not looking for canine guidance. She's not looking for orthodontic case type. She's looking for, wait for it, Naren, crowding or spaces.
Crowding or spaces.
Every hygienist on the planet can identify that. You have a temp hygienist in today. You could talk to your temp hygienist today about doing that in the patients that she's seeing today. And there you go. I have a client that literally on the strength of that tactic I just described to you, went from 3 cases a year. He was even less than the questioner. He was doing 3 cases a year to now doing a case a week, over 50 cases a year. The second is more external in nature. Master digital marketing, organic search engine optimization. It could even be pay-per-click around the field of adult orthodontics. So master that. So now people are finding you new patients are finding you based on the fact that they're interested in adult orthodontics. And the best way to do that would be to work with your firm, your marketing firm, Naren, and master digital marketing. You'll create the landing pages. You'll create the keywords and key phrases. You'll, over time, help that office get ranked. So when someone in their community is looking for adult orthodontics, you show up on page 1 of a Google search, and preferably near the top of the list of organic. And now you're going to get people calling you on the phone. Hey, do you do this Invisalign thing? And now they're already looking for you and they found you.
That's a great point. So there are literally like 30 to 40 different keywords you can target with regards to Invisalign. It might include city names, zip codes, near me, the best dentist for Invisalign, all kinds of combinations of phrases. So the first step is you have to dominate those set of keywords depending on your area and so forth. What I mean by dominate is you should show up organically without having to buy ads in the top page, the page 1, which is top 10 results, ideally towards the top 5 results. So that's step 1. Now, once they go to that page, within 90 seconds, if they come through SEO, you have to convince them to choose you. If they come through ads, you only have 15 seconds to convince them. So the great cases where you showcase the work, possibly a video or 2 where you explain things to, get them to like you. Because one of the fears people have about doctors is that, I cannot talk to this doctor. This doctor, is too technical. I cannot relate to him or her. So, being able to communicate things in layman's terms, them being able to watch that video and feel comfortable with you, so they are more likely to call you. Of course,
provide the link to your MSM, marketing strategy meeting, if you would.
Absolutely. It's ekwa.com/MSM. And what you're going to get from this meeting is, from a high value cases and marketing in general standpoint, how are you doing with Google? And if you're doing great, this is the reasons why. If not, here are the problems, very specifically. And along with a 12-month plan on like exactly what needs to happen for you to get into the top 5% of websites that get 95% of Google traffic. Also, we pay attention.
If you haven't already done that marketing strategy meeting, I would strongly encourage you to do that. This is a perfect solution to that question. You will now be found for people in your community looking for exactly that. It's a great practice builder.
Thank you, Gary. Appreciate it. Let me go to question number 3. I am in my 50s, mid 50s, and I plan to practice for at least another 10 to 12 years. Hopefully, I stay healthy. I'm now noticing that many of my patients need complex, comprehensive restorative care. Is it worth it to invest in the necessary CE at this stage of my career and to add these services to my case mix?
What a great question. I actually have an example in my client base of this very situation. Now, he was a little bit older. He was 58. I believe the question on this one said mid 50s. So I'd think of mid 50s, like 55, 56. My client was 58. And he said, Gary, I've been a bread and butter dentist for most of my career, but I'm noticing that my patient base is aging with me. And I have a lot of patients that are my age, that are in their 50s and 60s. So here's a fact that you may not know, but when I say it, you'll recognize it. If you've been in practice for a while, over time, your patient base typically mirrors the doctor's age plus or minus 10 years. Correct. So if you're 60, your patients are 50 to 70. Now there's exceptions, of course, but that's where the bell shape of your patient base is. Now, we made the comment earlier that sometimes your thinking about clinical dentistry morphs over time. And now you're thinking, hey, I've got all these patients, they love me, but their mouths are a mess, and I don't currently have the clinical skills to treat them. So here's what this doctor did at 58. He was very interested in, so again, the disclaimer, was he interested in doing this? And the answer is yes. This doctor went to Pankey. Now, I have a bias with Pankey. I'm on faculty at the Pankey Institute. I think it's a wonderful place for doctors to go learn how to do complex restorative dentistry. To be fair, I can name a couple of other places that are also great. Spear Education with Frank Spear in Scottsdale. Also, the Kois Center with Dr. John Kois in Seattle, to be fair. This particular doctor went to Pankey, and in a single year went through the continuum, went through a 4-course continuum over the course of a year, took one a quarter. They're week-long continuums, took 1 week a quarter. And as he completed that, he started offering more complex services to his patients. And this what made a tremendous difference in his practice. He was now able to provide the care that his patients needed. And of course, they wanted him to do it because they've been patients for many years in his practice. So, doctor, I'm going to give you a heck yes answer to that, to your question. As long as you're interested in it, the answer is heck yes. And I think you'll find maybe this next season of your career will be your most enjoyable. So yes, yes, yes.
Thank you, Gary. I have question number 4, the last question for you. One of the biggest frustrations I have is that PPO plans set my fees too low for me to provide treatments like veneers at a fee that would be profitable. Your thoughts?
Oh man, this is one of my pet peeves about the PPO plans. Why in the world should they be allowed to set fees on services that they do not cover? We need to lobby together as a profession, and we need to lobby against the insurance companies and not allow them to set fees on services that are not covered by their plan. But you're absolutely right, doctor. The veneer fee, it might be so mousy, you could never use the lab that you'd like to use for that veneer, and you can't be profitable. So really the short answer, Naren, is you need to get out of network. Yes. You need to get out of network because then you can charge a fair fee for that service. Now it works for you and it works for your patient. Now it's not easy. You can't just click your fingers and go out of network. But if you're interested in that, and you're interested in, doing the preparation to be able to successfully resign from PPO plans, come to our RITA Summit. Come to the Reducing Insurance Dependence Academy Summit on Friday, October 27th, 5 hours of CE, and you will literally have 20 experts that will help you navigate this and prepare to go out of network. And imagine the joy that you have where people in your practice want veneers. Now you can charge a fee that allows you to do it very profitably. And you're no longer beholden to the insurance company for those ridiculously low fees. Well, as we come to the finish line today, this has been a fun episode. Super GP versus staying in your lane. I hope we provided some thinking for you to help make that decision on an individual basis. Hey, if you want any help with that, in my coaching work, we are accepting new clients. You can go to thrivingdentist.com /CSM. CSM stands for Coaching and Strategy Meeting. That will open up my calendar, my schedule, and you can schedule a Zoom meeting with me. Purpose of that Zoom meeting is for me to get to learn more about your practice, and for you to get to learn about our coaching to determine if there might be a good fit. If helping make that decision about Super GP versus staying in your lane is on your bucket list, would love the opportunity to help provide some guidance if that was of interest to you. Some thank yous are in order. Thanks, Naren, for co-hosting this episode. Also, thanks for all the great work you do at Equa. If you haven't done it already, go to equa.com /MSM and schedule a marketing strategy meeting. I also want to thank our listeners. We appreciate each and every one of you. If you haven't done it already, please go to iTunes and write us a review. A review for the Thriving Dentist Show on iTunes will help more dentists find us. On that note, thank you for the privilege of your time. We look forward to connecting with you on the next Thriving Dentist Show.